Hi there and welcome. In this video, I'll briefly introduce you to behavioral activation therapy, an effective applied behavior analysis intervention used to treat clients with depression. Behavioral activation is a type of applied behavior analysis, a field of research based on the work of B.F. Skinner, especially on Skinner's findings that, in a given environmental context, behaviors that produce favorable outcomes will continue to occur through the process of reinforcement, and those behaviors that do not produce favorable consequences will decrease over time or extinguish. BAT has been defined as a structured brief psychotherapeutic approach that aims to A. Increase engagement in adaptive activities, which are often those associated with the experience of pleasure or mastery. B. Decrease engagement in activities that maintain depression or increase risk for depression. And C. Solve problems that limit access to reward or that maintain or increase aversive control. As a therapeutic intervention, most often used to treat depression, it allows clients with depressive symptoms to learn to cope with their negativity and to increase positive awareness through the redevelopment of personal goals in the form of short, medium, and long-term life goals. Thus, BAT helps clients to plan more activities they enjoy, or once enjoyed doing, develop their social skills to make the social environment more rewarding, and also helps them to track their emotions, particularly as those relate to various activities. One of behavioral activation's strengths is that it is highly customizable, each plan being set up particularly according to a client's values and preferred activities. It can also be customized for specific types of depression, and for those who have depression comorbid with other mental health conditions, such as personality disorders. Accordingly, nearly all cases of depression can be ameliorated with BAT. Unless you are a very new therapist, you are likely to have encountered the various debates which have raged in the field of mental health over the years, with some behaviorists in the past proclaiming the superiority of behaviorism over cognitive therapy, and other therapists touting the advantages of cognitive behaviorism, meaning that the added component of cognition is a more valuable target. Most modern CBT-style models include both components. Ironically, for proponents of the latter, at least one study has shown that a primary reason for the efficacy of CBT is the behavioral activation part of it. In this study, the study participants who completed a behavioral activation intervention alone saw as many benefits as other participants who completed both BAT and some cognitive components of CBT. Thus, BAT may be a big reason why CBT, deemed the gold standard treatment for many conditions, is so effective. At least we can confidently advocate for behavioral interventions, given that behavior, being observable, is much easier to target than thoughts. Beyond that, however, BAT is valued for its simplicity, the quickness and ease of learning how to apply its interventions, and the consequent cost-effectiveness of it. Unlike with antidepressant medications, there are no side effects, and because it is so simple, you as a therapist are likely to be able to deliver it with greater fidelity than you would more complex treatments. In terms of our collective societal mental health, it makes sense to treat as many people as possible with a simple, relatively brief, cost-effective therapy, which ordinary therapists can deliver, reserving more long-term specialist treatments for those who really need them. Some BAT manuals can often be used by clients on their own. There are a few situations, however, in which your client is better off working with you than dispatched, albeit with a manual, to their own devices. These include when they are manifesting shifts in mood without an obvious trigger. Here you could offer additional support to identify potential causes for mood shifts, which could include conditions such as bipolar disorder. Memory difficulties, anxiety or other mental health concerns could be at play, and should be explored for possible treatment. Panic attacks. Deeper looking into these, along with coping techniques, may be necessary for clients with panic issues. Trouble with basic functioning. If your client cannot take care of their essential needs, just scheduling in a few fun activities will not be sufficient intervention. Thoughts of death or suicide. You must, to be ethical and practice safely, be certain that your client is not in danger of harming themselves, with or without intention to die. Here are some key takeaways from this video. Behavioral activation therapy, BAT, is an applied behavior analysis used to treat depression. BAT helps clients to plan more activities they enjoy, develop their social skills, and track their emotions. Studies have shown behavioral activation as a primary reason for the efficacy of cognitive behavioral therapy, CBT. Behavioral activation is valued for its simplicity, the quickness and ease of learning, and cost-effectiveness. Clients should not pursue BAT alone if they experience mood shifts without trigger, memory difficulties, panic attacks, trouble with basic functioning, or thoughts of death or suicide. Thanks for watching this, and I hope you enjoyed your learning.